All right. Good morning. Thank you for the introduction, Roshan. Thank you for the opportunity to participate and join in on this symposium. And so this is what I'll talk today about is a series of projects that is really a series of studies that Annalise Anderson is conducting as a PhD student. So she's the one that's really writing the story. I'm just kind of up here reading it out loud today. You'll see Dr. Gisela Erf, who's a new fellow at this meeting, also included, and she's been a great mentor to Annalise and to myself throughout starting my career, especially early on, and has some very neat experimental models that we'll talk about that we've applied some nutritional approaches to. And so we've really been set up on where we are on reducing crude protein and limiting amino acids. And I was expecting that would be set up, so I'm not going to cover that and talk about why arginine is important. I mean, arginine is a formulation pressure point, can be a formulation pressure point. We see arginine on the market at economically feasible prices, and so it's something that we have to think about. Arginine is also tough to nail down at times, and this kind of has a reputation of being difficult to get consistent responses when we think about compared to lysine or other amino acids. And that's really, I think, because arginine has a lot of uses. So functional amino acids, kind of a buzzword. We talk about that all the time. But arginine truly does have a broad and dynamic set of functions that it's used. And, it's very hard to do it in chickens, but if we could really trace down quantitatively the uses of these different functions, I think they would be a high proportion of the overall needs relative to protein synthesis when we compare it to other amino acids. And so depending on the situation, the environment, the type of birds that you have, it really impacts the arginine response. And I think that's why we've generally considered arginine to be a little bit harder to get solid requirement data on. So I'm going to show a lot of titrations, a lot of responses today. I'm not going to provide a lot of recommendations. We're still doing additional analyses on some of these, but you can see the responses and kind of see where the plateaus would be, and I'll kind of mention that along the way. And so with all that said, I'm going to jump just kind of in. I was going to say into the weeds of arginine, but I guess, Bart, I'll say into the pool, the slightly warm and yellow pool of arginine, if you missed his or caught his joke earlier, and talk about what's happening there. But arginine has a lot of different functions. I'll talk about arginine today a lot as a substrate for nitric oxide, which is an important vasodilator. That's the easy one, but nitric oxide also has a lot of different immune functions. It's a signaling molecule. It has direct killing activity against a number of different pathogens. So nitric oxide is a big one. We don't hear about it as much, but arginine, along with ornithine, which can be produced from arginine, is in the glutamate family of amino acids, can be converted to glutamate. So it's also potentially a signaler of glutathione production. And so arginine is involved in antioxidant, whereas nitric oxide is more pro-oxidant. It's also involved in antioxidant. And so you have this big arginine demand anytime you have innate inflammation occurring. But then arginine also comes in on the repair side with polyamines being critical when cell turnover is high. Proline, collagen synthesis, and this we can relate this to wound healing, whether that be skin scratches or on pododermatitis. Arginine is often used topically in burn care and for medical applications for wound healing in human patients. So a lot of potential there, just showing the importance of arginine in wound healing. Same thing with proline, and then the energy to drive muscle growth and a lot of these other processes. It's involved in creatine synthesis, as we know, so a key regulator of energy metabolism as well. I know nobody likes to see a lot of pathways in a slide, but I think it's important to just put in context some of these different substrates and things that we're going to be talking about. So here you can see arginine, and this entire cycle here is the urea cycle, and I'll talk about that in the following slide about how the urea cycle and arginine interorgan metabolism ultimately is different between mammals and chickens. But just to give you a little background on some of these different amino acids and metabolites we're going to be talking about, arginine in the urea cycle. It doesn't start with arginine, but it can be broken down by arginase to produce ornithine. And that's the reaction where you get the urea. And so in the urea cycle, again, you're not getting much net arginine production in the urea cycle, which chickens don't have a complete urea cycle anyhow. That's where you get the production of urea. That ornithine then can then be converted back to citrulline and then cycle back to arginine. You also see arginine being catabolized by nitric oxide synthase, and that yields nitric oxide you see there, and then results in citrulline. So we're going to be talking about this citrulline NO cycle quite a bit as well, and you can see some of the other fates of arginine, GAA, ultimately to creatine in different functions. And so this is something I always like to review because there are a lot of arginine papers, and you've probably heard me say this in arginine talks before, a lot of arginine poultry papers that say arginine is an essential amino acid for chickens and not for mammals because they have an incomplete urea cycle. But as I mentioned, the urea cycle, the purpose of the urea cycle is not to produce arginine, it's to produce urea. And so even in mammals, the complete urea cycle in the liver does not produce net much arginine. It nets urea and cycles the arginine to produce more urea. Where arginine synthesis in mammals comes from is a combination of interorgan metabolism of the small intestine, generally some arginine coming in directly from the diet, but you also get a lot of arginine catabolism to citrulline in the intestine, and that citrulline coming from ornithine can then get to the kidney where it's converted to arginine, and then the arginine is available for systemic uses. In chickens, the enzyme to get ornithine to citrulline prior to this transfer is not there or at very low activity. So you're not getting the citrulline into the kidney. And on the other hand, the classic data show that the arginase activity in the kidney is very high. So the arginine that we do have there is often readily catabolized. So the combination of these two is why arginine is an essential amino acid in chickens, but not in mammals, where they can do these functions. And this is something we're actually looking more at now in our lab. I have an undergrad research fellow right now looking at kidney arginase activity, and we hope to explore this a little bit further. This is also why the classic literature shows that citrulline can spare arginine, but ornithine can't because you don't have this step. That's been done decades ago. This is also why we see some interest, potentially in citrulline because a lot of arginine is used by the intestine in first-pass metabolism. So citrulline can kind of bypass that. So that's probably something that, is of interest to this as well. Marcelo did a great job putting together all the different sources of recommendations. I kind of started on a similar path, but then I pulled back and said, just keep it simple. Let's look at some of the most, reliable recommendations that we have out there from the breeders and then the Brazilian tables, just to give you a context of where we are in some of the experiments that we're looking at different arginine levels. And so you can see the Avogen values there going from 106 to 110 to 112. Again, I have phase 1, 2, 3, 4 because all of these recommendations don't line up exactly on the timing or the size bird, but I selected the ones that line up the closest. I think the interesting thing here is, again, when we talk about variability of arginine responses, looking at these tables, you have one simple question: does it increase or decrease in a ratio relative to lysine as the bird ages? Because you have different recommendations depending on the source. And so I'm not too hung up on these specific recommendations, but just wanted to provide a context of kind of the levels that we've been looking at. And so I'm really going to talk about three different projects, and this is not exactly the order that we did these in. So we actually did the LPS model first. That's Dr. Gisela's model that I'll talk about. But in the context of the story, I think it makes it a little bit better to talk about the heat stress first, because we go from three different stressors. We have heat stress, in which we're not actually touching the bird to induce the stress. We're just making the environment hot. To LPS-induced inflammation. LPS, I'll explain, but it's a pathogen-associated molecular pattern, but it's not actually a pathogen, and so we're not infecting the bird with any pathogen to induce that innate inflammation. And then we end up with an intestinal pathogen. More recently, we're actually infecting the bird. So we really have three different types of stress. You can see the different levels. As I mentioned, this study was done first. You can see the highest level that we went to, 133. This study was done second, you see we went up to a 140, and then by the third one, we needed to go to a 153, okay? And there's a reason that top level increased every time, and I'll explain that as we go through the data. I'm not going to show diets in these. They're very similar corn soy diets, and we're using DDGs and corn gluten meal to get our arginine level down to that basically 80% lysine ratio relative to lysine. Other than that, just basically using free arginine to create the titration. So start with heat stress. Everyone's familiar with some of the impacts of heat stress. I just had a student finish his PhD, one of my last students at Arkansas on this, wrote a really great review. You can track that down, John Remy Tessier. But if you look what happens, different heat stress models obviously are going to impact the bird differently depending on the duration and the extent of the stress. And right off the bat, you can track 80% of the performance loss is going to be due to reduced feed intake. The literature shows that very well. His studies show that very well. And then that 20% reduction in performance is going to be feed efficiency, and that's a combination of oxidative stress, inflammation, reduced protein deposition due to increased protein breakdown. The bird gets less efficient, so we see fat deposition occurring, and then obviously more resources, including arginine, to vasodilation. And so once the heat stress or the heat production outpaces heat dissipation, this is the physiological scenario we're in. And so a long-standing question, I mean, this has been done for years. Dr. Brake did a lot of work that had a lot of traction around this of, increasing arginine as a precursor of nitric oxide, but also other relevant molecules to try to mitigate some of these responses. And so, we revisited this in the later phases when we know that the birds are dealing, even under thermoneutral conditions, as the birds get older, they're producing a lot of heat. And so heat stress is often most detrimental there. So you can see in this particular model, we had a common starter, a common grower, and then we maintained our titration from 80 to 140% digestible lysine, digestible arginine across the two finisher phases there, finisher 1 and finisher 2. And during that time is when we subjected the birds to a daily cyclic heat stress model, so 12 hours at 32 degrees C. And so going right off the bat, unfortunately in this situation, we didn't have an ability to run a full factorial where we have all the treatments in the thermoneutral, all the treatments in a control. But what we did do to ensure that we were inducing heat stress and to measure the heat stress is to measure temperatures at an early time in the morning, around 6 a.m. before the heat stress was applied, and then in the middle of the afternoon at the hottest part of the day. And so you can see the relative increase from the afternoon hot period to the cool period at the first time point that we measured this. So we did this on 2 birds per pen, every pen, cloacal temps with a digital thermometer. And the first time point was at 32 days. So you can see you get a pretty strong increase in body temp. And what was, pretty surprising is what a clean quadratic response we got in dietary arginine. So clearly dietary arginine was influencing the body temperature with the lowest body temperature occurring around the 1:16 ratio. Okay, that's one time point. Did it repeat? I'm not going to show the cool because we got the same relative increase. But when we did this again each week for the 2 subsequent weeks at 39 and 46 days, we see a quadratic response again at 39 days, and then at the oldest age, we actually see a linear response trending to a quadratic. So 3 different time points, we get the same response. Clearly that there's some direct impact of the arginine level on the actual cloacal internal body temperature of the bird. So now we look at what's kind of going on to maybe explain this. Here's plasma nitric oxide at 2 of those time points, 38 and 46 days. And would have been great to see the perfect dose response that lined up with that. That's not what we saw. You can see the values are relatively flat here. A little bit of a trend for a quadratic response at the first time point in blue. But the one thing to remember when you look at a blood marker like this, it's a one snapshot in time. Even though we have 2 different time points, it's one time during that day, and you're not really capturing the turnover of that and the overall production. Another thing to think about is, when you're just talking about vasodilation, you don't have to have large increases in nitric oxide that we see in inflammation. Okay, so the amount of nitric oxide to induced vasodilation. Dr. Bob Weidman did a lot of this work at Arkansas. Is not very high, so we may be seeing some levels there that we're just not detecting in this particular measurement. And so when we look at the plasma amino acids related to arginine, obviously we get a nice increase with arginine as the levels go up, showing that the arginine availability to the bird is increasing. One thing to keep in mind that I didn't talk about, and has kind of been mentioned, Dr. Greiner mentioned it, but there is a lysine to arginine antagonism in animals, and that seems to kind of happen at the transport level, so there's redundancies in the transporters. This is not just in intestinal cells, but in cells throughout the body. And that antagonism has shown to be worse when lysine is really high relative to arginine. So at these lower arginine levels, you actually have an inverse relationship between lysine and arginine, and then as it goes up, you see the linear increase. Lysine, nothing actually happening there. You would think if arginine was limiting, we might see a decrease in lysine because of better lysine utilization, so less accumulation in the plasma. Didn't see that. But when we look at some metabolites of arginine, ornithine and citrulline, again, I have all these scaled relative to their actual concentration, so these are being suppressed because of the high arginine levels. But we do see a linear increase in ornithine. So not only are we seeing the arginine, but we're seeing the product of the arginine metabolism. And then citrulline, which is directly tied with nitric oxide production, that's a product after the nitric oxide synthase. You don't see it, but there is a quadratic response in citrulline optimizing, or the highest between that 116, 128 ratio. So even though we didn't see the changes in nitric oxide, the co-product of nitric oxide production, we do see the response. And again, that may just be differences in the sensitivity of those assays or the timing. So now what does that mean for growth performance? So body weight gain, we actually didn't get a response to the arginine here. When we look at the feed conversion ratio, we had a linear response. So we didn't reach the plateau even at this highest level. So as I mentioned, we continued to, this was in the timing, this was actually the second study, but we did increase from the first study to 140. But even at this 140, we're not getting the plateau on feed conversion. You do see a plateau on breast meat yield, and this is a little bit different because a lot of times we'll see breast meat yield plateau after feed conversion. So very interesting response, makes a really good story about how most of these things line up. And I will say we ran a trial with cob birds. So these were all raw 708s that I showed. Made a really good story. We ran the same trial with cob birds at the same time. We intentionally confounded the study between the two birds with the feeding phase up to that a little bit, so we don't have a breed comparison to be able to talk about. But that said, the experimental conditions and the diets during the experimental phase were very similar, and we did not get the same response. We did see a response on feed conversion in the first finisher period. You can see there a linear response, but cumulatively, we saw no responses for the arginine, and we didn't see the temperature response. So I think it's important to keep in mind, yes, it worked very well for the one breed in the one situation, but we didn't see that. And this goes back to variations that we see in the literature on optimum arginine responses and how that can be variable under even very similar conditions, similar diets. Different birds respond differently. Okay, so now we'll move into the second piece of the story, lipid polysaccharide and the innate immune response. I already mentioned LPS is a pathogen-associated molecular pattern, and basically this is just conserved patterns that are recognized by the immune system. It initiates the innate inflammation. You can see there different cell types produce different types of molecules. Here's an example of different cytokines that are produced. We know, again, that's going to help coordinate vasodilation, recruitment of immune cells to the site of infection. Also, the acute phase proteins. So this is something that you don't hear as much about now, but, Kurt Klasing made a living injecting birds with LPS and looking at nutritional responses and doing the nutritional accounting of how many amino acids are going to the acute phase proteins, because these are very large proteins. They're produced in high concentrations, and so a pretty big amino acid demand, and it's been shown that, muscle can be catabolized to produce those. And so when we have LPS, we induce these strong responses, and Dr. Erf has done a lot of work highlighting the timeline of these with different PAMPs, including LPS. And so we wanted to apply this to her growing feather model. It's a very beautiful model. And basically what you can do is you can take individual feathers, which is basically just a skin derivative. She clips these feathers down, and as they're growing back, you can inject with a very tiny needle LPS or a control material into the feather, and then you can do that for multiple feathers and then collect the feathers over a time course, so you can basically get a very minimally invasive time course biopsy by just plucking out the feather pulp, and then she can analyze that tissue for a lot of different things. At the same time, she measures blood, so that's where the two-window approach, and so you can see the differences between the local and the systemic immune response on the same bird. It's pretty neat because she's even showed some data where you can do different feathers with different injections on the same bird and get distinct local responses. So it's a very, very beautiful model that she has. And so we want to apply the arginine response to that. Again, this was actually Annalise's first project in this. And Dr. Erf continued to mentor through this even after I moved to Auburn and before Annalise joined me there. But you can see kind of similar setup, except this time we're at the grower and the finisher phase. Our ratio is going, general ballpark, a little different, 77 to 133. You can see where we measure performance, and then at the end was when the birds were prepared and the growing feather model experiment was conducted. Just to give you a little more detail on this, again, you have samples that were taken before injection, and then at different time points, 6, 24, and 48 hours post-injection. So the LPS, this is the innate response. So you're talking in terms of hours and not days like we normally talk about with some type of intestinal infection model. So this is hours, and Dr. Erf's done a lot of work characterizing this, and so we knew really kind of where to look. This was not designed. This is a battery trial. We had smaller number of birds. This is a very labor-intensive process, so we have to be careful and cautious about the number of treatments and the number of birds. So it's not designed to be a growth performance study, but I think it was important to show the responsiveness to arginine under these conditions. So in this case, it's a little bit different response, as we didn't reach a plateau in body weight gain, although we did reach a plateau in feed conversion ratio with the lowest ratio around the 119 level. I don't know. Annalise calculated what the actual response was. I don't have that on the top of my head. One thing that's interesting to see is the variability seemed to be a little better and improved compared with the body weight gain. So we see the feed intake and the weight gain combining on the feed conversion being the most sensitive response really here. But moving into the inflammation. So these are different cytokines. And so here we have IL-1 beta, which is kind of a hallmark pro-inflammatory cytokine. We have IL-6, which is, and these all have different functions, but IL-6 is one that's often associated with acute phase protein production, signaling those. And then IL-8 is often involved in immune cell recruitment. And we actually see dose responses, either linear or quadratic, and this is in the gene expression in the feather pulp. So this is this site of infection, so this would be reflective of the local response. And this is actually a main effect. We did a time point, but this was actually a main effect across. So clearly, arginine is having a direct influence on allowing the immune response to occur. And this is, as I move into the heterophil to lymphocyte ratio, that's something that I want to make a point. I'm not suggesting here that we are inducing the immune response with arginine. We're inducing the immune response with the pathogen or the pathogen-associated molecular pattern, the LPS, and the arginine is allowing the immune response to occur. So I think we learned, again, Dr. Klasing helped us learn that. We don't want nutrients that, quote, fire up the immune response, but we want to provide the immune response or the nutrients that allow the appropriate immune response to the insult. And so if we look at heterophil to lymphocyte ratio, which is a marker, we use this as a marker for stress, general stress marker in poultry, but it's involved. Heterophils are some of the early innate immune cell types recruited. And you can see at 6 hours, a huge increase And then we see an arginine main effect. Even though it looks like there should be an interaction, we didn't pick it up. But there's the dose response of arginine at every time point, whereas arginine goes up, you tend to have a higher heterophil to lymphocyte ratio. Again, this is in the feather pulp, corresponding with the cytokines presented on the previous slide. Then you look at the systemic immune response. The numbers are a little bit different, but the same general pattern, where you see the peak at 6 hours, it's resolved, but then each time we have the main effect of arginine with, as the arginine goes up, the darker bars, you see the higher heterophil to lymphocyte ratio. Plasma nitric oxide, this is one where we did see a response in plasma nitric oxide where we actually saw the interaction because it's really driven by this six-hour time point. And so when plasma nitric oxide is highest or being called for to be highest by the immune response, you see a nice dose response to the arginine at that time point as increasing as arginine goes up. When we look at alpha-1 acid glycoprotein, we see both main effects and time effects. Alpha-1 acid glycoprotein is one of those acute phase proteins that I mentioned, very high demand of amino acids, are reflective of the positive pro-inflammatory acute phase proteins that have high amino acid demands, and actually follows a quadratic trend, as did IL-6 in the feathers, which again, that's kind of a coordinator. I don't know if those are directly linked or not, but clearly showing an arginine main effect there as well, a nice dose response. So now we move into our third project. And so this is where we went from heat stress to a non-pathogen innate immune response, and now we're going into an intestinal challenge. And this is something that I've been working on since a graduate student. We know that coccidiosis is a key intestinal pathogen that all of us worry about in production, and we also think about necrotic enteritis. And it's important to know that nitric oxide is directly involved in killing parasites, particularly protozoa, Eimeria, a lot of different intestinal parasites. Nitric oxide is a direct killing agent against those. Obviously, I mentioned the potential roles for arginine to signal glutathione to help with the repair and mediate that oxidative stress, and then polyamines to help in the resulting intestinal repair also. And so this is one of my favorite data slides from my PhD program. So I take the opportunity to show it any talk that's related to this. So if you've seen it 5 times, you get to see it again. But this was one of my first looks at arginine, and in this case, we're doing adequate and deficient. So we did deletion assays to try to identify most limiting amino acids. So Marcelo showed some addition assays. The opposite of that is you can do deletion assays. So you do an adequate diet, or what you think is adequate, delete individual amino acids, and then rank the responses, and that can help you determine the most limiting amino acid. And so we have the adequate and the deficient and uninfected and infected birds. And you can see we have gain to feed. This was when I was Illinois, so other than Dr. Greiner showing gain to feed in pigs, we're usually feed conversion, but bear with me, this is a gain to feed. Properly done, as Dr. Baker from Illinois would say, gain to feed response. So lower is actually better. Lower is worse, still takes time. So gain to feed and plasma nitric oxide. And so as we reduce arginine, you see there is a reduction in gain to feed in both circumstances. There's an interaction because that reduction is a little bit higher in the infected birds. But then when we look at plasma nitric oxide, it's much lower, obviously, in the uninfected, but it's also reduced with the deficiency. So in this case, beyond vasodilation and normal maintenance functions of nitric oxide is not being prioritized. And then when you have the infection and the large increase in plasma nitric oxide, the large deficiency, and I forgot to mention, this is a 40% reduction from the requirement. So this is a huge deficiency here. No reduction in plasma nitric oxide. So this tells us that the bird is sacrificing something else to prioritize that level of nitric oxide appropriate to that response. So we've done this with cocci. Until moving to Auburn, I've never actually worked with necrotic enteritis much, but we have a series of projects going on with that. And this was actually just conducted earlier this year, so we don't have a lot of the data, but I just wanted to show the simple performance responses because I think that's telling and it gets me excited about some of the other things that Annalise is going to do in the lab and learn from this. To set up the treatment, again, we didn't have the opportunity to run a full factorial, which is always bothersome to me. But what we did to try to mitigate that somewhat is we had 9 treatments. So we had the dose titration here, and then we actually took 2 unchallenged treatments at a 105 and a 129. So we at least have 1 2x2 factorial. And so the idea was to say, okay, if we get this interaction, then that gives us some indication that the requirement is changing, or the arginine responses is changing in the challenged birds versus the unchallenged birds. So we have that there to look at. And then we have the titration within the challenge, a 7-point titration. And as I mentioned, each time we find ourselves going up a little bit higher in the arginine ratio because we keep getting these linear responses. And again, I'm not suggesting anyone's ever going to feed a 153 ratio, but it's important to get a break point when you do this type of work. So we're trying to bend the line, and we keep finding ourselves going up every time. Here you can see our model. There's a lot of different models, a lot of different necrotic enteritis models. This is in collaboration with Dr. Hawk, who leads a lot of this work in our department. But we looked at the grower phase here. The other projects, we're looking at the finisher phases. In this case, we're looking at the grower phase to line up when we see these challenges in the field. We started at day 15 with a Imeria vaccine challenge at the 10x dose. They did 2 Clostridium perfringens challenge, and then a sampling at day 22. And we did carry the birds out beyond this to just kind of look at the recovery. I'm not going to show the processing data, but we did do processing on the birds just within the factorial diets. I'm just going to focus on that infection period for the arginine response, and the levels again there for your reference. So if we look at the body weight gain, here just looking at the factorial, I'm breaking it down in each case into the 2 different phases, the acute phase and the recovery phase. So this is that 7 days during the challenge and just after, a couple of days after the challenge, and then this is the week kind of in the recovery phase. And so we look at body weight gain, no impact we see a strong impact at challenge, but no impact of arginine or the interaction. Numerically less challenge during the recovery phase on weight gain, but still statistically significant. And then here we look at the titration on body weight gain. We do get quadratic responses to arginine in both the acute and the recovery phase. So there is some response there. You can kind of see where those, again, we just did this, into this trial a couple of months ago, and need to do further analysis as we get all of this in the lab. But when we look at the feed conversion ratio, this is when it starts to look interesting, okay? So if you look in the acute phase, there is a strong challenge, actually about a 20-point increase in feed conversion ratio with the challenge, so that it hits them pretty hard, but they recover very quickly. And so this is the thing that I think it's important to see, is when you look at the recovery period. So yeah, these birds are getting older, so they're a little bit higher in feed conversion this week versus this week, which we would expect, but they're actually lower in feed conversion in the challenge birds, so they're decreasing. And that's because the birds are obviously were impacted, so it was a lot higher than it should have been here, but that's a rapid reduction and restoration that's happening, has to happen to allow that feed conversion to get back to a normal level. And we also see not an interaction, but the main effect of arginine occurring during the recovery phase. So this makes it interesting to think about what might be happening there. And then when you look at the titration, it's really interesting because in the acute phase, we see a quadratic response to the arginine. So we hit the plateau, the maximum level that's going to promote feed conversion ratio. But when we get into the recovery phase, we don't reach that plateau. So showing that during that period of rapid intestinal cell growth, wound healing in the intestine, epithelial healing, we're not reaching that plateau. And I agree with what Dr. Greiner said earlier, that it is important to be a challenge, but before the challenge, to set birds up for success and make sure that intestinal development is not impaired. But that impairment should only occur if there's some deficiency that's limiting to the normal growth and development. And so where I think the real opportunity, and I've seen this time and time again with a coccidial challenge, the big nutritional opportunity is in the repair, in the recovery phase. The birds are so responsive to nutrients during that time. the growth, the compensation is so rapid during that time. So if you look at targeted nutrition opportunities, this recovery phase, in my opinion, seems to be one of the biggest opportunities. Again, this is specific to intestinal challenges that are actually inducing damage like this. So I'll wrap all this up by saying that clearly arginine is a multifunctional amino acid in dynamic metabolic roles. I mean, I think this is why often it's hard to pin down good arginine numbers, because depending on the conditions, the bird, we see a lot of different functions and needs and uses for the arginine, and that's going to vary across time and situations. There are real protective and reparative responses to stress that can be modulated and changed by arginine, okay? And so I know at the end of the day we're looking for performance, but these are things that do impact the performance and the efficiency of the bird. And I would say from the data that we have, feed conversion is the one that really responds to these, to modulating these responses, because this is the one where we're seeing or not seeing plateaus when we would expect to at pretty high arginine levels. And so I think feed conversion remains sensitive beyond levels that we see for other measurements. So with that, I'd like to thank CJ. They have funded each of these studies and have been great to work with, Jason and Roshan, so I really appreciate that. Again, I've already given credit to Annalise and Dr. Irv, and I really appreciate them. Dr. Hawk, and then Dr. Marco Rudar is helping us with the plasma amino acid and some of the other analyses, and then JR helped us a lot establishing how we like to do this heat stress model. And of course, my other lab team members that are here, thank you all for all the hard work on this, and appreciate everyone for your time today, and look forward to the discussion later this morning. So.